No se puede fabricar un riñón nuevo, o un hígado, o un corazón. ¿O sí?
Mi nombre es Gabor Forgax. En el futuro utilizaremos la capacidad de la naturaleza de formar órganos para crearlos nosotros.
El Dr. Forgax y su laboratorio están abriendo nuevos y radicales caminos para la creación de órganos internos. Crean los órganos célula por célula, literalmente imprimiendo copias de los órganos originales que nos dio la naturaleza.
¿Impresión de órganos? Suena como lo último en ciencia ficción.
Esta tecnología es considerada el futuro de la ingeniería de tejidos. Está basada en el hecho de que un grupo de células humanas, a las que el Dr. Forgax llama biotinta, se comporta como un líquido. Cuando se colocan uno junto al otro, los grupos fluyen y se fusionan, formando capas u otras formas.
Estas son las partículas de biotinta. Cada una se compone de entre 10 y 30.000 células.
Para construir estructuras tridimensionales como los órganos, Forgax y su equipo ensamblan las células humanas en la forma deseada. Es similar a cómo la impresora produce palabras. Las células sobreviven bien el proceso de impresión.
Esta es la bioimpresora.
Tu impresora no puede ensamblar objetos sólidos, menos aún un órgano humano. Pero esta lo hará. La impresora crea una hoja de biopapel apto para las células. Luego, imprime los grupos de células vivas en el papel gota a gota. Una vez en su lugar, la naturaleza toma el mando. Los grupos celulares se amalgaman entre sí, creando estructuras de tejido más complejas.
No podemos controlar cada detalle del proceso, pero resulta que eso no es necesario porque el material biológico, por su naturaleza fundamental, es capaz de autoorganizarse.
A medida que cada capa se completa, otra capa de grupos celulares es agregada.
Construimos el primer piso, luego el segundo, luego el tercero, y así es como llegamos al rascacielos.
Finalmente, el biopapel que se separa de las capas se disuelve y las capas individuales de las células se fusionan.
Y así creamos estructuras tridimensionales.
Dado que las células de cualquier órgano pueden atravesar este proceso de impresión, Forgax prevé que esta técnica se utilizará para sustituir órganos dañados. Y dado que el órgano será impreso a partir de tus propias células, habrá bajas probabilidades de rechazo.
That really has to do with our aging population. We're just getting older. Medicine is doing a better job of keeping us alive. But as we age, our organs tend to fail more. So that's a challenge, not just for organs, but also for tissues. Trying to replace pancreas, nerves that can help us with Parkinson's. These are major issues. This is actually a very stunning statistic. Every 30 seconds, we treat it with tissue regeneration or replacement. Wouldn't it be great if we could actually harness the power of our bodies to actually heal ourselves? It's not really that foreign of a concept. Actually, it happens on the earth every day. This is actually a picture of a salamander. Salamanders have this amazing capacity to regenerate. You see here a little video. This is actually a limb injury in the salamander. And this is actually real photography, time photography, showing how that limb regenerates in a period of days. You see the scar form, and then that scar actually grows out a new limb. So if salamanders can't do it, why can't we? Why can't humans regenerate? Actually, we can regenerate. Your body has many organs, and every single organ in your body has a cell population that's ready to take over at the time of injury. Happens every day as you age, as you get older. Your bones regenerate every 10 years. Your skin regenerates every 2 weeks. So your body's constantly regenerating. The challenge occurs when there's an injury. At the time of injury or disease, the body's first reaction is to seal itself off from the rest of the body. It basically wants to fight off infection and seal itself, whether it's organs inside your body or your skin. So we do regenerate, but for limited distances. What do we do now if you have injury for larger organs? What do we do when we have injuries for structures which are much larger than 1 centimeter? Then we can start to use cells. The strategy here is if a patient comes into us with a diseased or injured organ, you can take a very small piece of tissue from that organ, less than half the size of a postage stamp. You can then tease that tissue apart and look at its basic components, the patient's own cells. You take those cells out, grow and expand those cells outside the body in large quantities, and then we use scaffolds, materials. To the naked eye, they look like a piece of your blouse or your shirt, but actually these materials are fairly complex and they're designed to degrade once inside the body. It disintegrates a few months later. It's acting only as a cell delivery vehicle. It's bringing the cells into the body. It's allowing the cells to regenerate new tissue. And once the tissue is regenerated, the scaffold goes away. And that's what we did for this piece of muscle. This is actually showing a piece of muscle and how we go through the structures to actually engineer the muscle. We take the cells, we expand them, we place the cells on the scaffold, and we then place the scaffold back into the patient. But actually, before placing the scaffold to the patient, we actually exercise it. We want to make sure that we condition this muscle so that it knows what to do once we put it into the patient. That's what you're seeing here. You're seeing this muscle bioreactor actually exercising the muscle back and forth. Okay, these are flat structures that we see here, the muscle. What about other structures? This is actually an engineered blood vessel. Very similar to what we just did, but a little bit more complex. Here we take a scaffold, and we basically, scaffold can be like a piece of paper here, and we can then tubularize the scaffold. And what we do is to make a blood vessel, same strategy. We take a blood vessel is made up of two different cell types. We take muscle cells, we paste or coat the outside with these muscle cells, very much like baking a layer cake, if you will. You place the muscle cells on the outside, you place the vascular blood vessel lining cells on the inside. You now have your fully seated scaffold. You're going to place this in an oven-like device. It has the same conditions as a human body, 37 degrees centigrade, 95% oxygen. You then exercise it, as what you saw on that tape. And on the right, you actually see a carotid artery that was engineered. This is actually the artery that goes from your neck to your brain. And this is an X-ray showing you the patent functional blood vessel. More complex structures, such as blood vessels, urethras, which I showed you, they're definitely more complex because you're using two different cell types. But they're really acting mostly as conduits. You're allowing fluid or air to go through at steady states. They're not nearly as complex as hollow organs. Hollow organs have a much higher degree of complexity because you're asking these organs to act on demand. So the bladder is one such organ. Same strategy. We take a very small piece of the bladder, less than half the size of a postage stamp. We then tease the tissue apart into its two individual cell components, muscle and these bladder specialized cells. We grow the cells outside the body in large quantities. It takes about 4 weeks to grow these cells from the organ. We then take a scaffold that we shape like a bladder. We coat the inside with these bladder lining cells. We coat the outside with these muscle cells. We place it back into this oven-like device. From the time you take that piece of tissue, 6 to 8 weeks later, you can put the organ right back into the patient. It's a 5-second clip of a patient who received one of the engineered organs. We started implanting some of these structures over 14 years ago. So we have patients now walking around with organs, engineered organs, for over 10 years as well. I'm going to show you a clip of one young lady. She had a spina bifida defect, a spinal cord abnormality. She did not have a normal bladder. It's a segment from CNN. We are just taking 5 seconds. This is a segment that Sanjay Gupta actually took care of.
I'm happy. I was always afraid that I was going to have like an accident or something. And now I can just go and go out with my friends, go do whatever I want.
See, at the end of the day, the promise of regenerative medicine is a single promise. And that is really very simple: to make our patients better. Thank you for your attention.